Good morning, everybody. Thank you for having me to present at your seminar today. My name is Bianca Pillar and I am the Director of Global Relations at Jbi. So this morning I will be providing a brief introduction to Jbi, also to our international Jbi collaboration and the ways that working with the JBIC and being a part of this global collaboration, how it can help those organisations who are looking to improve EBHC in their organisation or practice. So, in the words of our Executive Director, connecting with you helps us to achieve our vision and mission. Connecting with you helps us to provide better evidence for better outcomes. And like our logo suggests, that it can create a ripple effect of change in healthcare globally. At its core, Jbi is concerned with improving health outcomes in communities by promoting and supporting the use of the best available evidence to inform decisions that are made at the point of care. Now, this work begins and ends with the needs of those working in and using healthcare services. Jbi seeks to respond to clinician questions and provide high quality, reliable information that is both pragmatic and useful. So in a snapshot, who is Jbi? Jbi is an international research organisation based at the Faculty of Health and Medical Sciences at the University of Adelaide in South Australia. We develop and deliver unique evidence-based information, software, education and training that is designed to improve healthcare practice and health outcomes. To achieve this, we work with universities and hospitals from across the globe through the Jbi collaboration. And in doing so, we ensure that the research evidence that we seek to synthesise, transfer and implement is culturally inclusive and relevant across the diversity of healthcare internationally. As I mentioned earlier, our vision is better evidence for better outcomes and a brighter future, and we achieve this by promoting and supporting evidence-based healthcare. Now, most health professions are increasingly embracing the concept of evidence-based healthcare, and many use evidence-based guidelines to inform rather than direct practice. Simply defined, evidence-based healthcare can be conceptualised as decision-making that considers the feasibility, appropriateness, meaningfulness and effectiveness of healthcare practices. The best available evidence, the context in which care is delivered, the individual patient and professional judgment and expertise of the health professional inform this process. So evidence-based healthcare does not eliminate the need for reasoning and reflection by the clinician. On the contrary, the clinician requires enhanced clinical reasoning skills when deciding which evidence and/or recommendations to follow. Now, some of you might be familiar with this. This is the Jbi model of evidence-based healthcare, which was initially developed in 2005 and updated in 2016. The inner red circle represents the pebble of knowledge, while the inner wedges outlined Jbi's conceptualisation of the steps that are involved in the process of achieving an evidence-based approach to clinical decision-making. The outer wedges operationalise the component parts of the model and articulate how they might be actioned in a pragmatic way. In order to provide those who work in and use health systems globally with world-class information and resources, Jbi considers the international evidence that is related to the feasibility, appropriateness, meaningfulness and effectiveness of healthcare interventions or evidence generation. It includes these different types of evidence in a formal assessment called a systematic review or evidence synthesis. It globally disseminates information in appropriate, relevant formats to inform health systems, health professionals and consumers or evidence transfer, and has designed programs to enable the effective implementation of evidence and evaluation of its impact on healthcare practice or evidence implementation. So it is this unique approach that is encompassed in the Jbi model of evidence-based healthcare. The top wedge demonstrates Jbi's belief that evidence-based healthcare should be driven by the needs of global health, with the achievement of improved global health seen as both the goal or endpoint, as well as the driving force of evidence-based healthcare. It also recognises that globalisation both connects and impacts the health of people across the world. Now, JBI understands that challenges in building an evidence base and capacity to implement evidence are diverse and vary between countries, regions, and cultures, and that differences in economics, clinical expertise, health policy, health systems, and resources often require strategies and solutions that are unique and specific to their local context. So with this in mind, JBI has a strong focus on engaging and collaborating with health professionals, academics, health facilities, and universities across the globe to determine what knowledge people need, what resources are available, and what limits constrain their choices in order to implement long-lasting and sustainable practice change. JBI achieves this in numerous ways, and truth be told, a complex number of ways. However, today I will focus on just 4 in relation to the JBI collaboration, including partnership, mentorship, capacity building, and global networking. The widespread impact of the work of JBI, both in Australia and worldwide, is attributable to the local and global partnerships that ensure that activities are context-driven by individuals and groups that understand their specific healthcare environments. It is through the JBI collaboration that JBI is well positioned to be a leader in producing, disseminating, and providing a framework for the use of the best available research evidence to inform clinical decision-making and improve health outcomes globally. So, who or what is the JBI collaboration? With JBI collaboration, we often refer to as the engine that drives our worldwide effort to promote and support the use of the best available evidence. JBI collaborates with more than 75 centres of excellence and affiliated groups in 38 countries across the world. Collectively, these collaborating entities are known as the JBI collaboration, or the JBIC. JBIC entities contribute to furthering the vision and mission of JBI globally. The structure of the JBIC is managed both regionally to foster collaborative efforts and mentorship and support novice groups by more experienced groups, and internationally through JBI in Adelaide in order to maintain our international focus and, where appropriate, to foster inter-regional collaboration. JBI prides itself on forming partnerships with mutual respect, a shared vision, and a true collaborative effort to ensure that all parties, irrespective of their geographical location, which language they speak or specialties they focus on, learn from each other so that meaningful and sustained outcomes can be achieved. The JBIC is the largest global collaboration to integrate evidence-based healthcare within a theory-informed model, the JBIC model of evidence-based healthcare, that brings together academic entities with hospitals and health systems. JBIC collaborating entities are self-governing and are initiated and coordinated through JBI. They are driven by a united desire to contribute to improvements in the quality and outcomes of healthcare globally through the delivery of high-quality programs of evidence synthesis, transfer, and implementation. The function of the JBIC are directed towards the knowledge needs of local clinicians and consumers, with each JBIC entity leading evidence-based initiatives in their region, country, state, or specialty. In this way, the JBIC contributes to the global success of JBI in promoting and supporting the use of the best available evidence to inform decisions made at the point of care. As a global collaborative evidence network, the value of the JBIC comes from the skills, knowledge, and the professional connections that we share with others. We often refer to this as social capital, which is the resources received from knowing others, resources embedded within, available through, and derived from the relationships within the network, and building networks like the JBIC that enhance the social capital of its members can bring together people who would otherwise not interact. The Jbi collaboration operates within what we call an activity matrix framework, whereby Jbi collaborating entities receive recognition for their activities via a point system. This system has been devised in order to formally acknowledge the important scientific, scholarly and collaborative contributions of JBIC entities to the ongoing mission of Jbi globally and ensure that the JBIC is an equitable and sustainable international network. Now, listed on the screen here are just a few of the 17 activities that, as a JBIC entity, you can undertake in your partnership with Jbi. The Jbi Collaboration Handbook outlines the key terms of agreement between Jbi and JBIC entities, and including the key performance requirements for entities aligned with the activity matrix, the operational guidelines of maintaining membership. The handbook also outlines in detail the specific requirements and guidelines for each of the 17 activities that entities may undertake within the activity matrix. Now, Jbi and its global collaborating entities offer short courses to promote and facilitate evidence-based practice in health settings globally. Many of you have already conducted the Jbi Comprehensive Systematic Review Training Program, which has led to me presenting to you today. So one of the many benefits of being part of the Jbi collaboration is having access to specialised evidence-based training for the conduct of evidence synthesis and evidence implementation, which prepares researchers and clinicians to develop, conduct and report systematic reviews in order to provide the strongest possible evidence to inform decision-making or clinical guidelines in healthcare. By the end of the program, participants complete and are ready to commence their protocol. Another short course that we have is the Evidence Implementation Training Program, which is a 6-month program that provides clinicians, managers, policymakers, and quality managers in healthcare with proven approaches to implementing evidence into practice. The program involves 2 5-day intensive training workshops and a 6-month evidence-based implementation project. Participants develop and engage in processes to further develop their leadership, skills and strengths, conduct clinical audits, which I'll talk about a little bit later, and develop and execute strategies to implement evidence-based practice in their own work and environment. Now, finally, the Train the Trainer program is designed to enable Jbi collaborating entity core staff or members of a JBIC entity to become accredited trainers to deliver these 2 programs, CSRTP and evidence implementation, in a manner that maintains consistency in the teaching and learning processes employed and help ensure that accredited trainers uphold the reputation and standing of Jbi. A key benefit of becoming a JBIC entity is the ability to become accredited and deliver Jbi training to your local networks. As a JBIC entity, Jbi provides free access to Jbi's EBP software and resources. Known as Special User Access, JBIC collaborating entity core staff are entitled to receive free access to Jbi's world-class evidence-based products and resources. I'll take you through some of these now. So Jbi's evidence-based practice database is an online resource for healthcare professionals to rapidly access up-to-date, high-quality, reliable evidence on a wide range of clinical and policy topics at the point of care. This includes Jbi evidence summaries, recommended practices, and best practice information sheets. These resources cover a wide range of medical, nursing, and allied health specialties, and the Jbi Ebp database includes more than 5,000 resources that have been analysed and appraised by global expert reviewers. There are currently 4,500 sites across 61 countries that access these resources via our commercial partner, Walters Kluwer Health. The Jbi Ebp database is indexed by 20 specialties, enabling users to easily undertake a specific search of specialty healthcare or practice areas. Each specialty of the EBP database is supported by a Jbi academic lead, an expert reference group, and a corresponding reference group. These consist of national or international members with experience and expertise in Jbi Ebp database specialty. Entry is by invitation and either the chair and by the chair of Jbi. Now, this is a new core activity of their Jbic activity matrix. So as a collaborating entity, you would be eligible to contribute to the development of these resources, particularly where you identify a gap in the evidence and practice in your local healthcare setting. So Jbic entities also receive access to Jbi's journal collection. Jbi is internationally recognised for the development of methodologies and methods of synthesising research evidence, which represent the benchmark of conduct for multiple different types of reviews. Our international journal, Jbi Evidence Synthesis, is the premier outlet for authors publishing reviews that apply the Jbi methods, including mega-aggregative syntheses, reviews of prevalence and cumulative incidence, reviews that move beyond inclusion of only randomised clinical trials and experimental studies, mixed methods reviews, umbrella reviews of quantitative and qualitative evidence, and reviews of text and opinion, and scoping reviews. Jbi Evidence Implementation, our sister international journal, is a theory-informed and pragmatically focused journal publishing case studies and papers from diverse clinical, cultural, and socioeconomic contexts that address the science and practice of evidence implementation into healthcare policy and practice. Finally, membership of the Jbi Collaboration provides you access to our software suite, which is inclusive of Jbi Summary, our synthesis software, and Jbi Paces, our point of care implementation, clinical audit and feedback software. So an essential program of work for Jbi and our collaborators is evidence synthesis. And to this end, Jbi developed Jbi Summary, a software that facilitates the conduct of systematic reviews. Now, many of you online today would have had access to this as a part of your comprehensive systematic review training program and are hopefully familiar with its features. But for those of you that are not, Jbi Summary supports the entire systematic review process from protocol development, team management, study selection, critical appraisal, data extraction, data synthesis, and writing the systematic review report. It is also the only systematic review software in the world that facilitates 10 types of systematic reviews, including multiple approaches within the one review. Jbi Paces is for healthcare facilities undertaking quality improvement projects, audits, or evidence-based practice projects. Jbi Paces provides an all-in-one solution that includes project setup, data collection and analysis, facilitating the process of change and applying evidence into practice. Jbi Paces is an online program that aids clinical audit and feedback in primary, acute, community and residential aged care settings, and it is a flexible program that supports healthcare professionals to improve healthcare practices based on the best available evidence. So now I've just provided an overview of some of the access to resources that membership of the Jbi Collaboration affords our collaborating entities. However, another one of the big opportunities is tapping into our global network of expertise. So one of the 17 activities that Jbic entities can participate in as a partner organisation is the Jbi Mentorship Program. This program provides a formal platform for experienced centres of excellence, some of whom have been partnering with Jbi for 25 years, to mentor new groups and groups that might be struggling to meet KPIs, that are not adequately resourced, including those from lower middle income countries. Over our 25-year history, Jbi has witnessed mentorship produce a wide array of positive outcomes for both mentors and mentees, and contribute to group cohesion and a sense of belonging to a strong organisational identity across the Jbi collaboration. In 2017, in its inaugural year, we had 7 mentor centres of excellence with 13 mentee groups across all 5 regions enrolled in the program. By the end of the first year, we had 2 new Jbi affiliated groups that were mentored and established. And as a direct result of the mentoring program, groups that had struggled for a number of years to publish systematic reviews and evidence implementation reports achieved publications. But most importantly, all centres and groups involved in the program referred to their mentoring relationship as rewarding, reciprocal, and mutually beneficial to both parties, with the exchange of knowledge going both ways. So this is just one example of the ways that the Jbi collaboration provides a formal opportunity, system, processes, and platform in order to help different groups across the world work together collaboratively, support one another, and share knowledge. So another way that the Jbi collaboration and Jbi builds capacity in lower middle income countries is through our philanthropic program. There are additional opportunities for professionals from our lower middle income countries to access resources and support from within the Jbi collaboration. We access funding and work closely with these groups to create an appropriate knowledge base to support health decisions and make this knowledge readily available at the point of care. Our philanthropic program is a part of Jbi's capacity building efforts in lower middle income countries. Health professionals often attend intensive training to learn about evidence-based healthcare and be equipped with the knowledge and skills to implement evidence into practice in their work settings. Importantly, the health professionals that access these programs learn and develop the communication and leadership skills required to instigate and sustain practice change to improve health outcomes in their communities. Pictured here is a group of health professionals that recently completed a 6-month training program in Kenya that was funded through this philanthropic program, where they had a focus on stemming the spread of COVID-19 in maternal child healthcare settings with great success. So I've just given a very rough and brief introduction to Jbi and the Jbi collaboration, going through some of the benefits of being a part of the global network. But I was also asked as part of this presentation to address how being a member of the Jbi collaboration, in particular being a JBIC entity, can help in nurse service design and in particular getting research into practice. So I'm going to briefly give an overview of evidence-based healthcare in nursing, Jbi's approach to evidence implementation, and how being a member of this collaboration can assist with this. So many of you will be familiar with what is called the research to practice gap. This is sometimes called the knowledge translation gap. Many researchers continue to work on this, but it's a well-known gap that exists in practice today. So what can we do about this research practice gap, in particular through the Jbi collaboration? New knowledge is not automatically translated into behaviour and organisational change, and this is why a large gap exists. Evidence is always evolving, and with new interventions, new techniques and new technology, this can be challenging. So much healthcare practice is low cost but high frequency, some is low frequency but high cost, and some is a blend of these characteristics. Nurses and other healthcare professionals have difficulty accessing evidence at the point of care, and this can be a significant barrier to quality improvement and evidence-based healthcare implementation. Practice change requires leadership, awareness and consideration of human behaviour, and change processes that are accessible, low cost and sustainable. In order to access, interpret and evaluate clinical effectiveness resources and decisions that impact on patient care, nurses also need specific skills and associated types of knowledge. There is also a logical flow as to how this should occur, beginning with knowledge leading to skill development, and the endpoint of skill development is clinicians who are equipped to provide and evaluate the effects of best practice implementation. So the JBI approach for evidence implementation is a pragmatic 7-phase process that guides evidence implementation projects. It is firmly grounded in the audit, feedback and re-audit process and a structured approach to the identification and management of barriers to change. This approach has been found to be successful in the JBI evidence implementation training program that I spoke about earlier. Much of the process itself has its roots in the quality improvement, evidence-based healthcare, plan, do, study, act cycle, and action research for evidence implementation. It is an ideal framework that can be adopted by evidence implementers and is both informed by and compatible with the major theories or frameworks and models discussed in the field of implementation science and behaviour change. So why audit and feedback? Audit and feedback is effective for moving from clinical decision-making to action, taking as part of a toolbox of change processes that are accessible, low cost and sustainable, which fit within an evidence-based healthcare model. Sustainable action does not occur in isolation. Rather, it is informed by model and methods that integrate the types of knowledge from systematic reviews and methods we have talked about today. You will be wondering why we focus on audit and feedback. It has a good, clear evidence from systematic reviews as practice change intervention. It is intrinsic to healthcare quality and it is therefore an approach that is already familiar to many in the healthcare system. If it's not familiar to you, it is cheaper, simpler, and more impactful than research of the same size and scope. So when we talk about moving from a traditional to an evidence-based culture, we talk about moving from the source of knowledge being expert opinion to the source of knowledge being, for example, gold standard systematic review of evidence, from the idea that clinical skills are the business of professionals or the profession, to clinical skills that can be audited and managed, from research being useful but separate to practice, to research and practice being interpenetrate with each other. The analysis of research is haphazard versus the analysis of research being systematic. The main sources of information being expert selected journals and books, to the source of information being through immediate point of care, access to summarised, systematically collected evidence, like those evidence-based resources I spoke about earlier in the Jbi Ebp Database. Moving from a model where most of what nurses and doctors need to know is in their heads versus nurses and doctors accepting that they cannot know everything and must use point of care information and tools constantly. Finally, moving from a model whereby patients do not have easy access to the knowledge base of nurses and doctors to a model where patients have as much access to evidence-based healthcare as nurses and doctors. So how do we do this? Well, JBI believes that an evidence-based organisation provides local access to on-site resources, including training programs on using evidence in clinical decision-making, access to summarised appraised evidence like that through the Jbi Ebp Database, online access to clinical audit and feedback tools, and online access to continuous outcome measurement. We also believe that an evidence-based organisation integrates planning and development for evidence-based healthcare with quality improvement and safety, and that it includes staff participation by creating capacity and sustainable resourcing. So an evidence-based organisation also develops clinicians' skills and knowledge and provides resources to promote evidence implementation, collaboratively develop clinical leadership and evidence-based change management in healthcare. So in addition to providing access to resources through your membership in the Jbi collaboration, access to training programs, including becoming a accredited trainer, for example, of the evidence implementation training program, access to global expertise and different specialty areas. Another thing that we encourage many of our entities and their clinical partner organisations to work towards is Jbi Endorsement. Now, Jbi Endorsement is a recognition that is awarded to health organisations or evidence-based practice organisations that we just spoke about that demonstrate a commitment to evidence-based healthcare and an organisational-wide culture of innovation and excellence. Jbi Endorsement can help provide hospitals, nursing homes, clinics or other healthcare services with the standards that it needs to garner status as an organisation with the highest quality healthcare practices. Jbi endorsed organisations are able to demonstrate credibility to patients, clients, practitioners and stakeholders and receive a variety of benefits as a part of JBI's global movement in evidence-based healthcare. Now, this is a program that Jbi has developed, and we've developed standards which we call the 3 Cs to drive implementation of evidence-based practice and improve the quality of healthcare. These standards represent the minimum acceptable requirements for the provision of high-quality healthcare. Within each standard, there are a set criteria on which to assess whether relevant structures and systems are in place to ensure standards of quality are met. So to be endorsed by Jbi, organisations must demonstrate compliance to the 5 criteria that sit across the 3 Cs. Now, organisations awarded with full endorsement receive the Seal of Excellence, including their commitment to the provision of evidence-based quality healthcare. These organisations can formally promote their endorsed status to the public, and fully endorsed organisations are recognised in all Jbi social media platforms and newsletters, etc. So the endorsement program is open to organisations that provide evidence-based practice and policy, including primary, secondary and tertiary care organisations, clinics and other outpatient settings, home health or community agencies and long care, nursing homes, hospices and aged care facilities. Most importantly, when we come back to the idea of getting research into practice, having the Jbi approach to evidence-based healthcare inform quality improvement programs within healthcare settings and contributing to improving service design within nursing, Jbi endorsement provides a really good framework with a minimum standard criteria to ensure that processes across all facets in your hospital and or ward are both informed by and achieving real practice change following the Jbi approach to evidence-based healthcare. So I'm just going to summarise briefly. The Jbi Collaboration membership enables access to Jbi resources and expertise, the opportunity to benefit from mentorship, partnership and capacity building within and across the JBIC, opportunities to collaborate with more than 75 entities across 38 countries to share knowledge, methods and amplify the work that has been done by individuals across the world, and the support of strong regional groups that meet twice a year. In terms of Jbi collaboration and nursing practice, the membership to the JBIC provides opportunity to train clinicians, including doctors, nurses and allied health practitioners with leadership potential, support partner hospitals to develop a core cohort with skills and knowledge in clinical leadership. It also provides access to Jbi Paces as the software of choice for evidence-based implementation and improvement at the point of care. In terms of the impact it can have for your organisation, membership helps, the opportunities that I've just outlined contribute to advancing knowledge and scholarship with methodology and method across synthesis and implementation science, building the capacity with the development of EBHC skills for individuals and teams, to inform decision-making, the active dissemination and transfer via education supported by our software resources and evidence, health and health system impacts, implementation informed by the situational and context analysis, and facilitation and evaluation, and partner locally and globally, and helps you to get connected. Professional impact at an individual level, again, helps to advance knowledge and scholarship, build capacity, evidence-based healthcare skills, inform decision-making and health system impacts. And professional outcomes, as an individual member of the JBIC or a JBIC entity, you have the resources, opportunity and skills to design and conduct systematic reviews that consider implementation as well as the findings using unique JBI methodologies. Publish in our peer-reviewed international journals. You could become a peer reviewer, become a JBI accredited trainer, and continue to engage with peers and field leaders locally and internationally. So, in conclusion, JBI recognises that healthcare is complex. There is no single linear approach that will work every time to move research evidence into policy and practice. Evidence will not always be feasible or appropriate or meaningful or even effective in a given context. JBI recognises that local knowledge, the capacity of healthcare professionals on the ground, communication and collaboration are critical. We therefore encourage and stand by the need for sharing and localising knowledge and supporting and engaging with health professionals, scientists and academics to take steps together, however small, to make a world of difference to health outcomes globally. Thank you very much, and I look forward to your questions.